This conference will now be recorded.
Welcome to the Spanish Medical Interpreters online class. We are happy to have you all here. Let's first review the learning objectives for this class. Learning objectives. In this class, we will learn to recognize and write the functions of the integumentary system, recognize and write the meanings of Chapter 12, word parts, and use them to build and analyze terms, and write terms for select structures of the integumentary system and match them with their descriptions. We will also learn to write the names of the diagnostic terms and pathologies related to the integumentary system when given their descriptions, or match terms with their meanings. Match surgical and therapeutic interventions for the integumentary system, or write the names of the interventions when given their descriptions. And spell terms for the integumentary system correctly.
Hey there, medical interpreters. Today, let's dive into the fascinating world of the integumentary system. First off, what exactly is the integumentary system? Simply put, it's the skin, the external covering of the body. But don't be fooled by its simplicity. The skin is the largest component of our immune system. It's our first line of defense against harmful pathogens. The skin's role doesn't stop there. It has a built-in cooling system through the process of sweating. As we sweat, the skin helps control our body temperature by excreting water and salts. Pretty neat, huh? Now let's talk about the skin's sensory capabilities. Embedded within the skin are sensors for touch, pressure, and temperature. These sensors relay vital information to the brain, allowing us to react to our environment. Imagine the skin as a communication hub, constantly sending messages to keep us safe and aware. To wrap things up, let's summarize the main functions of the skin or integumentary system. It covers the body. It protects underlying tissues, it helps control body temperature, it receives stimuli from the environment, and it excretes water and salts. Understanding these functions is crucial for medical interpreters like you, as it helps bridge communication between patients and healthcare providers. Thanks for tuning in.
Just remember that the functions of the integumentary system, as stated in the previous video, are as follow. It covers the body, protects underlying tissues, helps control body temperature, receives stimuli from environment, and excretes water and salts throughout the skin. Also, remember that the biggest organ of our bodies is the skin.
These word parts are used to describe skin. Recall that there are 4 combining forms that mean skin: cutaneo, dermo, derma, and dermato. Ichthyosis is a skin condition that has scales resembling fish, and xerosis is a condition of dry skin.
Sepso means infection. Asepsis means the absence of germs. Its literal translation is the absence of infection, such as in the description of a wound that is not infected. Septo also means infection or septum. Bacteri and bacterio mean bacteria, as in bacteriostatic, which means inhibiting the growth of bacteria, whereas bactericidal means killing bacteria. Cidal means killing. Derm means skin or a germ layer, and static means keeping stationary. Let's review the layers and structures of the skin from this picture. On the left side column, you can see the 3-layer of the skin. The first one is the epidermis. This thin outer layer is composed of 4 to 5 layers. Second, underneath the epidermis is the thicker dermis, which is composed of connective tissue containing lymphatics, nerves, blood vessels, hair follicles, sebaceous glands, and sweat glands. And the third one, beneath the dermis, is a layer of subcutaneous adipose tissue. On the left side of this picture, you can see on top of the skin, the hair shaft, next the sweat glands, the pilometer muscle, the sebaceous gland, the hair follicle, another sweat gland, blood vessels, subcutaneous fat, and nerves. Word parts, accessory structures of the skin. Sebo means sebum, pilo, and tricho mean hair. Axillo means axilla or armpit. Folliculo means follicle. Carato stands for horny, or cornea, onycho, and unguo mean nail. The accessory skin structures are hair, nails, sebaceous glands, and sweat glands. Sebaceous glands secrete sebum, an oily substance that lubricate the skin and inhibit the growth of bacteria. Sudoriferous glands, also known as sweat glands, help regulate body temperature through perspiration or sweat production. Hair follicles are tiny tubes of epidermal cells that contain the root of the hair shaft. Pilomotor muscles cause erection of the hairs. In response to a chilly environment, emotional stimulus, or skin irritation, hair develops in the axilla, the axillary region or armpit. During puberty, nails are composed of keratin, a hard, fibrous protein. Onycho and unguo are the combining forms for nail, and ungual is the adjective form for nail.
Primary lesions are the initial reactions to an underlying problem that alters one of the structural components of the skin, such as macules are small and non-raised freckles. Papules are small and raised moles. Plaques are elevated and appear as a large patch. Bullae are large blisters, whereas vesicles are small blisters. Pustules are filled with cloudy fluid, or pus.
Let's review some skin injuries. A wound is a physical injury involving a break in the skin, usually caused by an act or accident rather than a disease. The trauma or injury to the skin and underlying tissues requires healing to repair the defect. A laceration is a torn, jagged wound, whereas an incision is a smooth-edged wound produced by a sharp instrument. A surgical incision is performed under aseptic conditions so that it remains free of pathogenic organisms. A puncture is a wound made by piercing. An abrasion results when skin is scraped or rubbed away by friction. A keloid is excessive overgrowth of scar tissue at the site of a skin injury, particularly wounds or surgical incisions. And a contusion or bruise is caused by an injury to the body that does not break the skin and is characterized by swelling and discoloration. Quiz time. A puncture is A. A torn, jagged wound. B. A wound made by piercing. C. A scar. D. An erosion into the dermis. One volunteer at the time, please. Now, we will be studying some skin disorders. Cellulitis is an acute infection of the skin and subcutaneous tissue, characterized most commonly by local heat, redness, pain, and swelling. Albinism. Albino means white and ism means condition. Therefore, albinism is the absence of normal pigmentation, present at birth, caused by a defect in melanin precursors. The person affected with albinism is an albino. Contact dermatitis is a skin rash resulting from exposure to an irritant or to a sensitizing agent that initiates an allergic response, such as poison ivy, and allergic reaction to nickel in jewelry, as so forth. Cyanosis. Cyano means blue and osis, condition. So, cyanosis is bluish discoloration of the skin and mucous membranes caused by lack of oxygenated blood to tissues. And Dermatitis, dermato, means skin, and itis, inflammation. Dermatitis is an inflammatory condition of the skin. Frostbite is damage to the skin, tissues, and blood vessels as a result of prolonged exposure to cold. Furuncle is a localized skin infection originating in a gland or hair follicle and characterized by pain, redness, and swelling, also called a boil. Hypopigmentation is unusual lack of skin color, usually involving only localized areas of the skin and not the complete absence of pigmentation as in albinism. Lipoma, lipo, fat, and oma, tumor, is a benign tumor consisting of mature fat cells, malignant melanoma, melano, black, and oma, tumor, is any of a group of malignant tumors that originate in the skin and that are composed of melanocytes. Mycodermatitis, myco, fungus, is an inflammation of the skin caused by a fungus. Pediculosis, infestation by lice and named for a genus of sucking lice. Pediculus. There are head lice, body lice, and pubic lice. Scabies, a contagious dermatitis caused by the itch mite that is transmitted by close contact. Scleroderma, sclero means hard, and derma, skin, is a chronic hardening and thickening of the skin. Skin cancer, any of several neoplasms of the skin, the most common and most curable malignancies. Urticaria is a skin eruption characterized by wheals of varying shapes and sizes with well-defined margins and pale centers. Its causes include drugs, foods, and insect bites. It is also called hives. Xerosis, a minor irritation of the skin characterized by excessive dryness. Quiz time. Inflammation of the skin caused by a fungus is A. Furuncle, B. Mycodermatitis, C. Psoriasis, D. Scleroderma. One volunteer at the time, please. Now, we will review a couple of disorders of the accessory skin structures. First, we will review the acne vulgaris, which is a skin disease characterized by blackheads, the result of blocked hair follicles becoming infected with bacteria, whiteheads, and pus-filled lesions. And second, seborrheic dermatitis, commonly called dandruff, is an inflammatory condition of the skin that begins with the scalp, but may involve other areas, particularly the eyebrows. The meanings of the next 7 terms should be evident to you because of your knowledge of word parts. Folliculitis is an inflammation of a hair follicle. Hidradenitis. Hydro means sweat. Adeno means gland. And itis, inflammation. So, hidradenitis is an inflammation of a sweat gland caused by occlusion, or closing off, of the pores with subsequent bacterial infection of the gland. Onychomycosis is any fungal infection of the nails. And onychopathy is any disease of the nails. Seborrhea, sebo means sebum, and rhea, discharge. So, seborrhea is excessive production of sebum. Seborrheic dermatitis is an inflammatory skin condition that begins with the scalp, but may involve other areas, commonly called dandruff, trichosis. Tricho means hair, and osis means condition. Any abnormal condition of hair growth, including baldness or excessive hair growth in an unusual place. Surgical and therapeutic interventions. A topical medication is a drug placed directly on the skin. A transdermal drug delivery is a method of applying a drug to unbroken skin. The drug is absorbed through the skin and then enters the circulatory system. Antimicrobial is a medicine applied to broken skin to prevent infection. Antiperspirants act against or inhibit perspiration, aspiration, the act of withdrawing fluid from a cyst using a syringe. And a biopsy is the removal of a small piece of tissue for microscopic examination to confirm or establish a diagnosis.
Hey everyone, welcome back. Let's deep dive into surgical and therapeutic interventions. I'm breaking down some key procedures for the integumentary system. Let's jump right in. First up, cryosurgery. This method uses sub-freezing temperatures to destroy abnormal tissue. Think of it like freezing off warts or precancerous lesions. It's quick, effective, and minimally invasive. Next, curettage. This involves scraping material from a surface to remove abnormal tissue. It's often paired with cryosurgery for a 1-2 punch against skin lesions. Moving on to debridement. This is crucial for wound care. It involves removing foreign material and dead or damaged tissue. This promotes healing and prevents infection, especially in chronic wounds. Now let's talk about dermabrasion. This treatment uses revolving wire brushes or sandpaper to remove superficial scars. It's often used for acne scars and it leaves the skin smoother and more uniform. Then there's electrolysis. By passing an electrical current through a substance, we can destroy it. Often used for hair removal, it targets hair follicles in undesirable areas. Lasers can also be used for a similar effect. Lastly, electrosurgery. This uses high-frequency electric current to perform surgery. It's particularly useful for destroying skin lesions. Quick and efficient, it minimizes bleeding and speeds up recovery. So there you have it, 6 essential treatments for the integumentary system. Understanding these procedures can greatly enhance patient care and outcomes. Thanks for tuning in, and I'll see you in the next video.
Quiz time. Hidradenitis is A. Inflammation of a hair follicle. B. Abnormal condition of hair growth. C. Dandruff. Or D. Inflammation of a sweat gland. Acronyms and abbreviations. BX stands for biopsy. DLE stands for discoid lupus erythematosus. And TBSA stands for total body surface area. Let's review the pharmacology section for Chapter 12, Integumentary System, antipruritics, relieve itching. They can be topical anti-inflammatories, anesthetics, antihistamines, or counter-irritants may be used for their antipruritic effect. Example, diphenhydramine, Benadryl, and hydrocortisone, cortisone 10. Antipsoriatics, treat psoriasis. Example, acitretin, Soriatane, anthralin, Drith cream, calcipotriene, Dovanex, and secukinumab, Cosentix. Anti-rosacea, agents, reduce skin redness by topical vasoconstriction. Example, brimonidine, Mirvaso. Antiseborrheic drugs, reduce amount of sebum produced to treat dandruff. Example, ketoconazole, Extana, selenium sulfide, Selsun Blue, and coal tar, Denarex. Astringents, dry and contract skin tissue. Example, calamine, calamine plain, and witch hazel, Tux. Counter-irritants, rube facients, create inflammation topically to lessen pain-causing inflammation nearby. Example, camphor, Vicks VapoRub, and menthol, Stopane. Keratolytics, shed top layer of skin to treat acne or remove warts, corns, or other lesions. Example, azelaic acid, Phinacea, benzoyl peroxide, Benzac AC, and salicylic acid, compound W. Retinoids, regulate epithelial cell growth to treat acne, psoriasis, and other skin problems. Example, adipoline, Differin, tazarotene, Tazarac, and tretinoin, Retin A, scabicides and pediculicides, kill scabies, lice, or mites. Example, ivermectin, Sklice, lindane, Scabine, and permethrin, Nix. Do you have any questions, comments, or concerns that want to share with us?
Thank you so much for joining us in today's session. Your active participation is greatly appreciated. If you have any questions, concerns, or suggestions for enhancing our online sessions, please don't hesitate to reach out to us. We are dedicated to ensuring that your learning experience is as enriching and effective as possible, and we're more than happy to accommodate your specific needs. In the meantime, we encourage you to take some time to review the video, explore your ebook, and engage in the online practice exercises and tests. We eagerly anticipate reconnecting with you in our next online session. Wishing you a delightful remainder of the day.